Emotional disturbance and behavioral disorder typically develop in childhood or adolescence. While some emotional issues may be normal in children, those who have behavioral disorders develop chronic patterns of aggression, defiance, disruption, and hostility. Their behaviors cause problems at home, school, and the worksite, and usually interfere with relationships. Children with emotional disturbance and behavioral disorders may develop personality disorders, depression, and bipolar disease like in adults. Children with behavioral disorders may throw frequent extended tantrums, hurt themselves or others, get involved with criminal activities, lie, smoke, use alcohol or drugs, be openly defiant, or engage in early sexual activity. They may skip or fail school and have a higher than average risk of suicide. Although the cause of emotional disturbance is not known, risk factors have been identified, such as family history of mental illness or substance abuse, exposure to tobacco or illicit drugs during fetal development, abuse, stress, lack of supervision, and inconsistent but harsh discipline. On the other hand, children with behavioral disorder may have other mental, emotional, and behavioral disorders such as attention deficit hyperactivity disorder (ADHD). Severe or long-standing behavioral disorders can be difficult to treat. However, early recognition and intervention can be quite helpful. Treatment often focuses on skill development of the child and parent. Involvement of a healthcare professional is often necessary. Educational, community, and school programs are also available for that student to be participating in. Violent, destructive, and risky actions can be a part of behavioral disorders and can lead to severe or legal problems. A teacher should always contact immediate care if a student is hurting themselves or endangering the teacher or any other student in the classroom or at the school site. A teacher should seek prompt medical care if a child gets into trouble frequently, has significant mood swings, engage in harmful or destructive behaviors, use alcohol or drugs, has problems sleeping, or is having other issues that cause any concern. Part of the parenting skill training focuses on learning interventions to help improve a student's behavior, and this can relate to teachers as well. Teachers should use interventions which include allowing a student to make concrete but limited decisions, such as wearing a blue shirt or a green shirt. Avoid rationalizing and ignoring poor behavior. Develop a clear system of rewards and punishment. Getting involved in the student's participation of activities. Modeling and teaching a student of acceptable behaviors. Reducing stress in the classroom and at home. Rewarding appropriate behavior, and setting clear expectations. Although I have not worked with students with these disorders, I would try and implement as many effective teaching methods in my class. I would create a structured environment which outlines and requires self-discipline, create specific rules and result in observable and measurable behaviors, teach social skills, self-control, self-monitoring, conflict resolution, and more. Children with conflict disorder like to engage in power struggles. They often react badly to direct demands or statements such as "you need to" or "you must." They may consistently challenge class rules, refuse to do assignments, or argue with you and fight with other students. This behavior can cause significant impairments, both social and academic functioning. They also work best in environments with high staff-to-student ratios, one-to-one situations, or self-contained programs when there's plenty of structure and clear expectations. Their frequent absence and their refusal to do assignments often leads to academic failure. Keep in mind to have these students participate in the establishment of rules, routines, schedules, and expectations. Be aware that teachers can unconsciously form behaviorally express negative impressions of low-performing, uncooperative students. Try to monitor our expressions, keep them as neutral as possible, communicate a positive regard to the students, and give them the benefit of the doubt whenever possible.